have a problem in St. Louis. Our infant mortality rates are some of the worst in the country. Black babies are dying at 3 times the rate of white babies before they turn 1. Why are Black people in St. Louis at higher risk? It's definitely not because of poverty, it's not because of education, and it's not because of genetics. It's because of racism. Racial inequities are at the root of all things that impact infant mortality in our region. Racial equity is when all residents, regardless of zip code and race, have justice and opportunity to thrive. In St. Louis, Black families don't have the same access and opportunities as white families, and that is impacting our health. Systemic racism goes beyond a person's individual biases. It's the policies and practices entrenched in institutions that harm certain racial groups and help others. The systems that serve our society, government, education, healthcare, businesses, they were all designed by white people and designed to serve their interests, not ours. Over time, it becomes the way we do things, and people don't even realize that these systems were designed to put minorities at a disadvantage. Black families in St. Louis are facing systemic racism every day. Where we live, the schools our kids go to, the jobs we work, the quality of healthcare we receive. In all of these areas, we have less opportunities and worse experiences. Black babies are more likely to be born premature because of the stress and racism their mothers experienced. Let's be clear, Black babies aren't dying because of genetics. African women who have recently immigrated to the U.S. have nearly the same infant mortality rates as white women. However, within 1 generation of living in the U.S., African-born women have significantly higher rates of infant mortality as a result of being Black in the United States. It's important to note that a Black woman's experience with racism throughout her life, not just during pregnancy, causes stress that contributes to actual physical changes in her body. Years of stress can cause her cells to age too quickly, resulting in inflammation and hormone changes, which lead to conditions like preeclampsia and hypertension, which can ultimately result in premature birth. And for me, this is personal. I lost a child at 18.5 weeks of pregnancy, and it was because the medical staff wouldn't take my concerns seriously, and a life that could have been saved ultimately wasn't. I used this information several years later when my husband and I decided we wanted to start our family. We knew we were going to have to advocate for our child. We knew that we were going to have to fight to ensure we got the quality healthcare that we deserved. And we went into it with a mindset that we were not going to give up, that we were going to determine the future of our child. As a Black woman, I knew that I had to fight even harder for my child. I had to fight even harder to be heard. And I remember my words, my concerns not really being taken as seriously as they should have been. Because of that, our daughter was born healthy, but she was still born at 29 weeks despite everything that we did. That is why it's critical that we activate the region now, dismantling systems that don't work for Black families. We can't lose any more time.